If you or someone you know has been dealing with erectile dysfunction ED, you've probably heard of various pills that claim to help. But with so many options out there, it can be hard to know which one to choose. So, in today's video, we're going to discuss the best pills for erectile dysfunction and what you should consider before deciding what's right for you. Alright, so I assume you already know what erectile dysfunction is, right? That's why you clicked this video. Okay, for those who don't, what ED is. It is the inability to get or maintain an erection sufficient for sexual intercourse. It's a condition that affects millions of men worldwide. So, if you're suffering from ED, you are not alone. And with proper medications and lifestyle, it can totally be reversed. While it's often linked to aging, it can also be caused by factors like stress, anxiety, health conditions, and certain medications. There are many ways to treat ED. Medications is one of them. There are several medications available. Okay, so number 4. Stendra, often called Avanafil because it contains Avanafil. Stendra is one of the newer medications for ED. It works quickly, often within 15 to 30 minutes after ingestion. This is faster than some other ED medications that I'm going to explain later. It has a relatively short half-life, meaning it doesn't stay in the body as long as some other ED medications. Clinical trials have shown that Stendra is effective in treating ED. Stendra can be taken with or without food, and moderate alcohol consumption, up to 3 drinks, does not seem to reduce its effectiveness. However, excessive alcohol consumption can increase the risk of side effects. The recommended starting dose of Stendra is typically 100 milligrams taken about 15 to 30 minutes before sexual activity. If you're experiencing side effects, then reduce the dose up to 50 milligrams. Who should not take Stendra? If you're on nitrate medications, like often prescribed for chest pain, or men with significant heart disease, recent heart attack or stroke, uncontrolled high or low blood pressure, or certain other cardiovascular conditions should avoid Stendra. Okay, so number 3, Levitra, often called Vardenafil. Again, it's highly effective at treating ED. Levitra typically takes about 30 to 60 minutes to become effective. And the effects of Levitra can last up to 4 to 5 hours. Levitra can be taken with or without food, although a high-fat meal may slow its absorption. Moderate alcohol consumption does not significantly affect its efficacy. Now, if you're diabetic, then this is for you. Because studies have shown that Levitra is particularly effective for men with diabetes. But consult your doctor first. So, the recommended starting dose of Levitra is typically 10 milligrams taken about 30 to 60 minutes before sexual activity. And again, like Stendra, 5 milligrams for those who experience side effects or for whom the 10 milligrams dose is too strong. Who should not take Levitra? Well, same, as explained for Stendra. Number 2, Cialis, often called Tadalafil. You might have heard about this because this one is kind of popular. Cialis can remain effective for up to 36 hours, which is significantly longer than other ED medications like Stendra and Levitra. Cialis typically starts working within 30 minutes to 2 hours after ingestion. Cialis can be taken with or without food, and moderate alcohol consumption does not significantly affect its efficacy. But if you're on the way to treat ED, you need to stop drinking and smoking. Just quit. And clinical trials and real-world use have demonstrated that Cialis is highly effective in helping men achieve and maintain erections sufficient for sexual activity. Okay, so the recommended starting dose is 10 milligrams taken at least 30 minutes before sexual activity. Depending on effectiveness and tolerance, the dose can be adjusted to 20 milligrams or reduced to 5 milligrams. Now, this is the pill you can take daily. The recommended dose for daily use is 2.5 milligrams taken at the same time every day, without regard to the timing of sexual activity. And who should not take Cialis? Well, same as explained for others earlier, but additionally, it can interact with alpha blockers for high blood pressure or prostate conditions. Okay, so number 1, Viagra, often called sildenafil. It is one of the most well-known and widely used medications for erectile dysfunction. Why it is considered one of the best? Well, with many years of clinical use and research, Viagra's safety and efficacy profile is well understood, providing confidence to both doctors and patients. It also has been extensively studied and has a long track record of success in treating ED. It helps men achieve and maintain an erection sufficient for sexual activity by increasing blood flow to the penis. Viagra typically starts working within 30 to 60 minutes after ingestion. The effects of Viagra can last for about 4 to 5 hours. Okay, so if we talk about the dosages, the typical starting dose is 50 milligrams taken about 1 hour before sexual activity. Viagra should not be taken more than once a day. Who should not take Viagra? Well, it's the same as told earlier. Additionally, individuals with severe hypotension, low blood pressure, should not take Viagra, as it can further lower blood pressure, and men who have had a stroke, heart attack, or serious arrhythmia within the last 6 months should avoid taking Viagra without medical supervision. So, why do these pills work? The common factor among all these medications is that they are PDE5 inhibitors. PDE5 is an enzyme that breaks down a molecule called cGMP, which is responsible for relaxing smooth muscle tissue and allowing blood to flow into the penis. By inhibiting PDE5, these medications increase the levels of cGMP, promoting better blood flow and enabling an erection. Alright. So, if you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to my channel for more health tips and advice. Take care, and I'll see you in the next video.